This program is sponsored by the Neuroscience and TMS Treatment Centers. Call 615-348-8200 for a free TMS consult. I'll be talking about depression. Depression is a disease that affects the brain's networks. It causes symptoms of depressed mood, loss of interest, sleep disturbances, guilty, hopeless, and helpless feelings, energy changes, concentration or memory changes, appetite changes, reduced pleasure, and sometimes thoughts of death, dying, or even suicide. Many people have depression. It is the most disabling illness in the world. In Middle Tennessee, there are approximately 100,000 people who suffer from depression. When treating depression, the goal is to get the patient into complete remission. We call this wellness. With current treatments like medications and therapy, less than half of people treated for depression get well. Antidepressant medications are the most common treatment for depression. The majority of medications have side effects which can complicate getting well. Medications only address half of the picture when it comes to depression because the brain is an electrochemical organ. TMS, which stands for transcranial magnetic stimulation, is a revolutionary technology that is based on established science. In fact, the electromagnetic theory that gave rise to TMS was first demonstrated in 1831 by an English scientist, Michael Faraday. It took another 150 years and more scientific findings before a group of engineers at the University of Sheffield developed the first TMS devices in the 1980s. Within the next decade, many research clinicians published original TMS studies for depression. Here are two of the most noteworthy. Clinical research proved that TMS was successful at treating depression without medications, and over the years since those studies, the treatment has been perfected. Most offices can get around 30% of patients into remission and close to 60% into response. TMS delivers a pulsed magnetic field into the brain which generates an electrical field. With repeated treatments, the depressed networks in the brain improve their functioning. TMS is very safe for most people. Only individuals who have ferromagnetic metal in their heads, like an aneurysm clip or a cochlear implant, should avoid TMS. There is a very rare seizure risk, but the most common side effect of TMS is some minor scalp discomfort under the coil. In our offices, we add medications and psychotherapy to the TMS treatment, and nearly 60% of our patients remit and over 80% respond. We developed and utilized the Train Your Brain online TMS workbook. Our clinicians and TMS operators give extra attention to our patients and teach other clinicians how to improve outcomes nationally and internationally. We look forward to hearing from you and finding out how we can help you reach your wellness. Call us at the Neuroscience and TMS Treatment Centers for your free TMS consult.